Today we have a patient, 32-year-old man from Philippines. His complaint was thinning of the hair from the crown, mid-scalp and the frontal area. And now I would like to ask him, how did he choose GLOJAS?
Coming here in GLOJAS, when I searched it like 3 months ago, the first one to came out was the GLOJAS hair transplant.
Thinning of the hair from the crown, mid-scalp, the frontal area, and more hair loss at the frontal temple angle. So we have drawn the design according to what the patient wanted, and we fill up the hair. We increase the density at the frontal temple angle on the right side, similarly on the left side, and at the forelock we increase and we did some dense backing here to stop the light from penetrating inside here. So patient will follow the medical protocol here so that the existing hair will be reversed and will become thicker, and these will match with the hair transplant hair in 9 months to a year down the road.